Hi, it's Tom Clark from the MTech Access NHS Insights and Interaction team. Just a quick video here to introduce you to our weekly COVID update sessions that we're going to be doing every Friday from now on to bring you insight from the front line of the NHS to you, our clients, about what's really going on in the NHS at this unprecedented time. The idea is to help you and industry plan in real time and respond to the challenges being laid down in the NHS at the moment, which is obviously particularly difficult at the moment with a lot of restrictions around movement and engagement with the NHS. We're going to be asking our NHS colleagues from our health service faculty and our pool of associates to volunteer around their day jobs to provide brief summaries of how COVID is impacting them now and how they expect that change to last. We're going to steer clear as far as possible from conversations around PPE and testing and focus more on the fundamental structural questions that will really impact on how companies are able to plan in the coming months and years. So from next Thursday, the 9th of April, and then every Friday until it's appropriate to stop, we're going to be doing these online sessions for you to register for. So a quick update on the current situation, and myself and my colleague David Thorne are both working with primary care networks at the moment in voluntary capacities to help them with their planning and their resilience work. We're also speaking regularly with our colleagues around the country in different NHS roles about what they're seeing at the front line, the challenges they're facing and how they're overcoming them. What we're seeing in primary care is that it's being pushed to modernise rapidly. Lots of movement towards video consultations and remote working, but the capabilities there are largely immature. This is obviously to avoid patients coming into practices. Every patient in most practices is now being triaged remotely rather than being seen face to face, and then only those that really need a face-to-face consultation are coming in. The infrastructure to support this is being fast-tracked, so there's a procurement of thousands of laptops, which is even more difficult because primary care IT has largely been made obsolescence with the post-WannaCry needs to update tech. Lots of the laptops in primary care just aren't up to the job, so there's very little in practices already and a lot of training required about how to use the new technology without the resource to do so. Primary care networks are also being asked to coordinate huge amounts of activity ahead of the planned timelines. The PCN agenda is all due to come into play really from April this year. Lots of more advanced stuff is actually being done now that wasn't really in their timelines. That's a huge test for both the leadership within the PCNs and also the appetite of practices to engage in that level of collaboration. An example of the collaboration is the setting up of hub practices to manage work on behalf of others, hubs and spokes that are being accelerated to share staff, and that brings with it issues around HR and consistency among how people are practicing. In hospitals, they're in quite an unusual position at the moment, having massively reduced activity in some areas, such as elective operations being cancelled and emergency department activity and attendances being much lower than normal. On the other hand, obviously there's immense amounts of energy going into planning for the COVID wave that is due to come, so there's a feeling of a calm before the storm. Trusts are starting to see the impact in their respiratory critical care and ICU departments, and as the wave that we're expecting and the peak comes, that's likely to spread throughout the hospital. Well, obviously huge amounts of planning being done to mobilise all parts, all staff of the hospitals into supporting that COVID response. But for now, there is strange levels of quiet amongst parts of the clinical community. Among community services, local authorities, third sector providers, there's been a much greater level of an engagement than ever with healthcare services. A lot of that to facilitate just discharges from hospitals to make the space for the expected COVID patients. Planning for more activity being delivered through community hubs and visits as well. So all those patients that are isolated at home, still needing care, that won't be able to access their usual services. There's a huge amount being done by the councils and community services to to provide that outreach using volunteer groups and all sorts of healthcare and social care assets in the community to reach out to them. The key message to take away from a lot of this is that the change taking place is consistent with the long-term plan agenda. It's just supercharged. So everything to do with integration, collaboration, working more closely is really what the long-term plan is all about, and that's what's going on in most of the country. Lots of the barriers to doing that are being removed very quickly, as there's obviously a collective desire to make things happen. We're very conscious that when we do return to our normal ways of working, whatever that might look like, the NHS is likely to look and feel very different to what it does today. So our challenge is to help you keep as close to the changes as possible. Rather than telling you about the theory of the NHS and everything that has happened in the past to this point, we really want to help you scan the horizon and prime yourselves to hit the ground running once the doors are unlocked again. So if you and your organisation are feeling a sense of uncertainty about what's going on in the NHS, you need to start getting some clarity to help with your planning. And if you want regular updates from some of the most insightful people in the NHS into what's really happening in their world and what's going to change for good, then please register your interest using the link accompanying this website, this webcast. The registration is limited for the live broadcast, but anyone registering that doesn't manage to access the live broadcast will receive a link to a recording. So from next Thursday, the 9th of April, and then every Friday, we'll be inviting two of our closest colleagues from the NHS to join us to present on what they're seeing, how they expect that change to last, and have a short discussion around the impact of COVID on engagement with industry as well. So we look forward to you joining us. Look after yourselves, keep washing your hands and stay safe. We'll see you next week.